Good afternoon, everybody. I'm very delighted to share my work with you today. I really wanted to thank Patrice and Eric and also colleagues and friends at ASAP for organizing this amazing conference. So as we all know, this year marks the 37th anniversary of the ASAP conference. And actually, my disclosure for this talk is that I'm going to be 37 in a couple of months. So I guess we could say that our conference, ASAP and myself, are both hitting our strides together. How can I? Okay. And also, as it happens, today is actually World Brain Day, a day dedicated to improving brain health and well-being of our patients around the world. And I just couldn't think of a better setting to mark this occasion besides standing here in front of you and sharing our work and also learning from each other because we all work together to improve the lives of those with Chiari Malformation and Syringomyelia. So just to give you a quick recap, so we are now looking at a zoom-in picture of the cerebellum. So this is an MRI scan taken from a healthy individual. So as we learned from our previous talks, the cerebellar tonsil is contained within the skull, allowing CSF to flow normally, to drain normally. But as we know, in patients with Chiari Malformation, the cerebellar tonsil herniates through the foramen magnum. So this, in effect, blocks the normal CSF flow. And in order to overcome this blockage or this herniation, as the CSF dynamics within the Chiari Malformation patients often moves in a much stronger fashion than healthy individuals. So now in these images, the white substance or the white part actually represents the CSF. And actually yesterday, some patients asked me how we look at different MRI scans, why sometimes the CSF is dark, sometimes it's bright. This is just a way that radiologists or MR technologists do some basic tricks to have different contrast. But in this case, the CSF is represented using white or brighter colors. So now, although we can see CSF in white in these static MRI images, it's very difficult for us to look at or to visualize its dynamics or its motion. Well, this is because CSF actually moves very, very slowly. Too slow for conventional MRI scanners or MRI techniques to capture the motion. But also, I think, given a challenge like this, this also presents many opportunities for us to develop novel imaging techniques or even AI technologies nowadays to be able to visualize these slow-moving CSF or even the brain itself. So therefore, in my talk today, I'm going to share some exciting results from our recent work using MRI to reveal previously hidden brain motion in Chiari patients that may enhance diagnostics. So what do I mean by hidden motion or hidden brain motion? So we may not think about this very often because our brain doesn't really move very often. But in reality, it actually moves us a little bit, very, very subtly. And this movement turned out to be quite important in keeping our brain healthy. So to explain this concept, let's actually first look at the beating heart, which is a moving organ. So as we can see here, we can use an MRI technique known as cinematic MRI, or in short, cine MRI, to produce a movie for the moving heart. But did you know that with each heartbeat here that we are looking at, our brain actually has a corresponding movement or a pulsation? So I found this interesting video from the internet. Now, basically, when the heart pumps blood, it sends a streams of blood through the arteries. And this stream of artery creates a very small and very, very tiny pulsation, which can actually cause our brain to move a little bit. So this motion is sometimes called the cardioballistic motion. And our heartbeat is basically one of the main driving forces for the brain motion. And there's also another force, that is the CSF flow. So as we learned from many previous speakers today, CSF is produced in the ventricles and then flow around our brain, contained by the arachnoid. And then through outpouching mechanisms, the CSF eventually it just circulates around the brain and then flows back to the venous system and eventually to the heart. But as I said earlier, CSF flow is extremely slow. Now, as CSF constantly and slowly circulates our brain, it also creates a tiny pulsation to the brain that we could potentially capture using advanced imaging. So therefore, both arterial pulsation and the CSF flow can create brain motion. So now you may be asking me, so how big is this brain motion created by arterial flow and CSF flow? So here's an interesting study performed many years ago by a group of scientists who were trying to figure out the same question. And the color map here indicates the amount of motion or the amount of displacement of each pixel in different directions. And here, basically, blue means no displacement, no motion. And warmer colors such as pink or yellow or orange represents larger motion. So we can observe the pixels at the cerebellum, which actually shows the highest degrees of motion. But however, as we can see on these numbers here, the amount of motion is only about 0.15 millimeters. This is actually shorter than the diameter of our hairs. Now, another limitation for this method is that the whole scan took 20 minutes, over 20 minutes to acquire, because the motion was really too small to capture. Therefore, this is really not practical in our clinical applications to be used for our patients. But still, it raised a very interesting question. That is, if the motion is the greatest near the cerebellum, even in healthy subjects like this one, what does brain motion look like in patients with Chiari Malformation or Syringomyelia? So as we've seen earlier, we can use cine MRI to detect cardiac motion. And naturally, we ask the same question, can we use a similar technique like this to capture brain motion? Well, the answer is yes and no, as many scientists often tell you. So here we are looking at a side-by-side movie from a patient with Chiari Malformation and a control subject without any brain diseases. And actually, each frame of this movie was taken after each heartbeat. And now you may be asking me, I cannot see any motion here at all, but I promise you, I'm showing you a movie here. You're not alone. But as we discussed earlier, there is motion, right? Because the brain moves slightly, driven by the cardiac motion, the cardioballistic motion, and also CSF circulation. But it's just that it's very hidden here. Therefore, using very advanced signal processing techniques, our team developed an exciting technology to amplify this brain motion that is previously hidden or previously invisible. And when we apply these techniques to patients with Chiari and also a control subject, we found something quite fascinating. That is, the patient with Chiari malformation actually demonstrated much greater motion than the healthy control subject. Now, let me just reassure you that our brain doesn't actually move like this in reality, because if it did, we'll be really in big trouble. But what we are seeing here is that the motion is amplified by this algorithm. And it's kind of like, turning up the volume in our radio, or, when we can hear, we want to hear a very low voice, or we want to hear a whisper. So this really helps us visualize these tiny hidden differences that would otherwise be invisible using conventional MRI scans. And also, if you think about the underlying biomechanics, this kind of makes sense, right? Because the brain needs a stronger force to overcome the barrier created by the cerebellar herniation in Chiari patients. Therefore, the CSF can drain back normally, as in the control subject. Now, another advantage of our technique is that, unlike the previous study that I shared with you, which took over 20 minutes to take the scan, our technique only needs 5 minutes to produce a movie like this. Therefore, it may be applicable in clinical applications. And the exact amplification technique, or the amplification process, includes a couple of steps that I listed here if you're interested. But the key step here is that we actually decompose the MRI data into the magnitude component and the phase component. And for each component, we apply a temporal bypass filter to remove the static signal, the static elements such as the neck or other not moving components. And we only amplify the small and subtle motion near the CSF and the ventricles. So actually, scientists have been using video amplification techniques before we applied this technique. So please don't be scared by this video. Let me just briefly explain what's going on here. So originally, scientists who are working on computer vision discovered the amplification technique to reveal hidden arterial pulsation in facial selfies, like here. This is actually the leading researcher who discovered this technique. So here we can see that the left video shows the scientist's face without any amplification, and the video on the right is what it shows after amplification. We can even see the color changes on the skin that actually represents the arterial pulsation. And then building upon this technique, scientists also used motion amplification to monitor baby's heart with the goal of knowing the baby's cardiac functions without actually taking an ICG in a NICU, for example. So here we are looking at videos of the baby's face and then amplified to reveal the subtle color changes in the baby's face. And the change in the color actually represents the cardiac cycle and the arterial pulsation. And then by analyzing the amplified video data, we can determine the baby's heart rate, which is actually consistent with the values that we can see here, the readings on the ECG. But one interesting observation here is that the baby actually has a heart rate of nearly 150 beats per minute. But actually, this is completely normal because, in fact, children often have much higher heart rate than adult patients who have a normal heartbeat ranging between, I would say, 60 to 100 beats per minute. I'll come back to this point later in my talk. But our group was the first to apply such video amplification techniques in brain imaging or for Chiari patients. And we are working on a sub-pixel level, detecting motion far smaller than a single pixel, a movement that we often never notice even without enhancement. So if you're like me, who like to play motion video games such as Call of Duty and so on, this idea might be similar to you, because you might remember in the video game you can see some smoke flickers and your gears reacting to explosions. So those effects are in essence amplified by the gaming system, by the gaming engine, to really make small visual details stand out to give you a more dramatic and vivid sensation. But what we are doing here in MRI is kind of like that, but instead of making a battlefield look more cool, we are revealing tiny biomechanical motions of the brain that were previously undetected. So this really inspires us to perform a cohort study to study brain motion between patients with Chiari malformation and healthy control subjects more deeply. So with this support from Stanford Children's Hospital, we pursued a cohort study to compare brain dynamics between patients with Chiari type 1 and normal controls. And we enrolled 10 patients with confirmed diagnosis of Chiari type 1 with symptoms such as headaches, neck pain, and dizziness, and so on. And they didn't have any other neurological disorders, and also none of them had any decompression surgeries. We scanned their brain using our new imaging protocol, including the amplification algorithm before and after their decompression surgery. And we also enrolled 10 normal control subjects as the control group. And our goal here was really to evaluate whether amplified brain motion would be able to serve as a meaningful imaging biomarker for Chiari-related biomechanical changes. So in our analysis, we took a step further to compare the amount of amplified motion quantitatively. Now, the variance map, or the heat map here that we can see, represents the amount of displacement for each pixel after amplification. So as we can see here, the displacement of each pixel after amplification in Chiari patients were significantly higher than the amount in the healthy control group. So these findings really supports the notion of impaired biomechanics at the brainstem and the cerebellum in patients with Chiari in many previous studies, and also a lot of our previous speakers mentioned this. But we were able to visualize this and also quantitatively analyze it. So this is very exciting because we can use amplified motion potentially as a novel imaging marker to identify patients with Chiari malformation, and also potentially to evaluate their amplified motion before and after decompression surgery. Now, interestingly, our technique has gained a lot of popularity among other teams. So here's an interesting study that's recently published. Now, in this paper, the team looked at the same question from a slightly different perspective. So they decomposed the amplified brain motion into different components in adult patients, actually in 3 different components. The anterior-posterior direction, the superior-inferior direction, and as well as the medial-lateral direction. And this paper found that on a group level, in adult Chiari patients, patients have a significantly higher brain motion in the AP direction, in the anterior-posterior direction. Remember earlier we also discussed the hallmark of Chiari is this herniation of the cerebellar tonsil, and some of our speakers said that there's this threshold of 5 millimeters for diagnosis. And it turns out that in the same paper published by this team, they found that the amplified brain motion also significantly correlates with the length or the amount of herniation of the cerebellar tonsil. So in short, I think the message here from all these diagrams is that the more herniation there is, the more obstruction it causes to the CSF flow. And also the more the brain must pulsate or move stronger to overcome the resistance. So this is likely why we see increased anterior-posterior and as well as superior-inferior motion in these adult Chiari malformation patients. Now recall previously we learned that children have much faster heart rate than adults, often as high as 150 beats per minute. So this really presents a unique challenge because I told you that our video amplification technique relies on taking one MRI scan after each heartbeat. Therefore, we need to capture brain motion in children or even babies within such a quick cardiac cycle, which really requires more efficient imaging. Fortunately, our team developed a protocol that uses parallel imaging techniques that allows us to acquire these MRI movies in small children or pediatric Chiari malformation patients within just a few heartbeats. So this really makes our method particularly well suited for pediatric patients who not only move more physiologically, but also move more within the scanner. So therefore, we are not just looking at the amplified motion, but we are also looking at how this motion behaves in a faster developing brain. Of course, there are so many open questions from these studies, not only for pediatric patients, but also for adult patients. Just in the context of pediatric patients, we are always wondering how sedation would affect brain motion because as some of you may know, a lot of our young patients require sedation during their MRI scans. And also another interesting question would be how the position of the head within the MRI scanner would affect the CSF motion or the amplified brain motion. Well, this is important because we have already seen in some preliminary data about the different patterns of the brain motion even in the same subject when the head is positioned differently. So in essence, this really make us wonder, how things like gravity affects brain motion. So far, I mean, none of our studies were able to account for this effect. But I'm happy to perhaps report back to you in next year's conference. Just thinking ahead, we also expect that amplified video motion, amplified MRI will be able to reveal similar brain motions or even spine motions in other brain diseases, such as the ones that we discussed this morning, such as including brain tumors, hydrocephalus, tethered spinal cord, and other malformations affecting CSF flow, both CSF flow and intracranial pressure. And this approach really may extend well beyond just pediatrics. So in summary, we discussed a new brain imaging technique inspired by video games to reveal hidden brain motion in Chiari malformation patients. And our pilot study demonstrated that Chiari patients exhibited higher brain motion, higher amplified motion than the healthy control subjects. Now, as some of you may recall, at the reception last night, we all laughed about different ways or different generations learning different skills. For example, some of us, as the comedian mentioned, learn new skills by making mistakes at the playground. Others, perhaps the younger ones, learning new skills by watching TikTok videos. So I really hope that my talk inspired you to think beyond what's available with the help of technology, and also how much we have accomplished. Because with the help of technology, we can now make MRI scans more dynamic, more vivid, more animated, and even more amplified. And of course, there are so many open questions, and I look forward to exploring them and discussing them with you during the panel discussion period. Finally, I would like to share a personal story. So earlier this year, I had the privilege to visit Charles University in Prague in the Czech Republic. It was quite meaningful because at Charles University in 1891, Hans von Chiari, then professor of anatomy at Charles University, first described this malformation back then that we have been discussing at our conference today. And obviously, people named the disease after him. And I was honored to speak at a workshop there, which served as I think, a temple for studying brain diseases. And standing in the place where Chiari was first discovered really made me realize that how scientific progress often bridges generations and countries together. And it is truly an honor for me to share my work with you today. Thank you.